Cushing's disease or Cushing syndrome is too much cortisol. Treatment with steroids or ACTH from organ transplant, chemotherapy, autoimmune diseases, asthma, or cystic fibrosis. Tumors, these are causes, tumors of the pituitary gland. These can cause this Cushing's disease, release ACTH, cancer, adrenal hyperplasia, adrenocortical carcinoma, carcinoma of the lung, GI tract, or pancreas. So here you have a gentleman with Cushing's syndrome. Personality changes, high glucose hyperglycemia, CNS irritability. He's going to have a moon face. It looks like cheeks puffing out. Increased susceptibility to infection. Males have gynecomastia, fat deposits on the face and back of shoulders, sodium and fluid retention, edema, thin extremities, GI distress with increased acid in the tummy. Females have amenorrhea, hirsutism. I think that's male characteristics. Hirsutism. Thin skin, purple striae, bruises, and petechiae. And osteoporosis because the stress and then low calcium, it causes deficiency in the bones. What testing is done for Cushing's? You're going to want to test serum electrolytes. It's opposite of what you'd find for Addison's. Compare. So with Cushing's, you're going to have high glucose hyperglycemia, high sodium hypernatremia, low potassium hypokalemia, low calcium hypokalemia, such as the osteoporosis. On your CBC blood count, you're going to have a decreased lymphocyte count, so decreased white blood cells. What testing will be done for Cushing's? This is a nice to know but not a need to know for your testing for Cushing's. So dexamethasone suppression test determines whether dexamethasone has an effect on cortisol levels. Important for diagnosing adrenal hyperfunction and distinguishing its cause. Rapid testing, client takes a dose of dexamethasone before sleeping and blood sample is obtained after waking and before and getting out of bed, typically at 2300 and 0800. No decrease in blood cortisol level. Test is repeated again with a higher dose. Prolonged testing, baseline 24-hour urine cortisol prior to 2 continuous days of urine collection, while dexamethasone is administered every 6 hours. That's another test. And monitor blood glucose and potassium after testing. Results, blood cortisol levels will decrease only after the higher dose of dexamethasone is administered, at least a 50% decrease along with increased ACTH. So what should be included in the plan of care for a client with Cushing's disease? Remember this moon face and low cortisol or high cortisol. If due to steroid use, you're going to want to reduce the steroids to the lowest level possible or alternate high and low dose steroids. If due to adrenals or pituitary gland dysfunction, maybe even you might have to do surgery. Monitor intake and output, daily weight, sodium restriction, 2 grams per day, that's 2,000 milligrams, or 4,000 grams per day with a fluid overload. 2 to 4 grams per day, sodium restriction. Safe environment to minimize risk pathologic factors due to osteoporosis and skin breakdown. You need to watch for skin breakdown, infection prevention, monitor white blood cell count with differential daily, plus frequent hand hygiene and surgical asepsis as their immunity is decreased. Encourage physical activity and meticulous skin care should be done daily. We're at slide 39. What is the non-surgical management of a client with Cushing's disease? Drug therapy to decrease cortisol production, aminoglutamide, metyrapone, and ketoconazole. Ketoconazole is adrenal corticosteroid inhibitor. Most common is ketoconazole antifungal that inhibits adrenal corticosteroid synthesis. So we want to decrease this increased cortisol. Monitor liver enzymes and indications of liver toxicity. Relief is temporary, only temporary relief with this drug. Take with food due to GI upset. Midotane for inoperable adrenal tumors. It works by destroying the adrenal cells. Produces selective destruction of adrenal cortical cells. Monitor for indications of shock, renal damage, and hepatotoxicity, liver. Lifelong replacement with glucocorticoids is likely. Hydrocortisone, most commonly prescribed for this. That's the steroid for this. And then replacement therapy for clients who have adrenal cortical insufficiency as a result of treatment for Cushing's disease. If it's type 2 diabetes, we have that listed. Slide 40. What is the non-surgical management of a client with Cushing's disease? Increased ACTH production with type 2 diabetes and don't respond to other therapies. Mifepristone, Korlym, synthetic hormone that blocks glucocorticoid receptors, not to be used with pregnancy. Hypercortisolism from pituitary adenoma, pasireotide signifor, this medication binds to somatostatin receptors on the adenoma and inhibits production of corticotropin, leads to lower levels of cortisol production in the adrenal glands. Decreased in tumors from signifor, ineffective for patients whose tumor do not have somatostatin receptors. Slide 41 or 21 of the Cushing's. What is the surgical management of a client with Cushing's disease? Total hypophysectomy, surgical removal of pituitary gland, operative procedure, transsphenoidal or transfrontal craniotomy, post-op care, replacement of electrolytes, frequent checks of vital signs, monitor drainage from mustache dressing. Remember the Brad Pitt picture. Prevent skin breakdown, prevent pathologic fractures, monitor for GI bleeding, CSF drainage on gauze dressing, and look for that glucose in there, which would be a halo sign, would see yellow on edge of drainage, and in the middle of drainage would be clear, indicating CSF fluid, cerebrospinal fluid. Refrain from coughing, blowing nose, or sneezing, which increases intracranial pressure and leads to bleeding. This would be post-op surgery. Assess neurologic status every hour for the first 24 hours and then every 4 hours. Avoid constipation by using stool softeners to prevent straining. Give high-fiber foods to help. Numbness at surgical site and or diminished smell for 3 to 4 months. Avoid bending over and straining. Avoid brushing teeth for 2 weeks. Instead, floss and rinse mouth with warm water. Here's the Brad Pitt. Here we have the pituitary gland, location of tumor, sella turcica, and sphenoid sinus. If you had a pituitary tumor, it doesn't show the mustache on them. Mustache dressing. What is the surgical management of a client with Cushing's disease? Adrenalectomy, one or both of the adrenal glands are removed. Important to know that removal can precipitate an adrenal crisis. Patient must be monitored for signs and symptoms of adrenal crisis. Signs and symptoms of an adrenal crisis would be hypotension, low blood pressure, tachycardia, so that's the fast pulse, tachypnea, rapid breathing, nausea and headache. Administer glucocorticoid and mineralocorticoid replacement. Post-op care would be provide glucocorticoid, mineralocorticoid, and hormone replacement. Monitor for adrenal crisis. Monitor vital signs every 15 minutes initially, and monitor incision site. Due to electrolyte disturbances that can occur, then ECG monitoring should take place. Cardiac monitoring needs to be completed. Remember, for especially with potassium, high potassium. What testing is done for both Cushing's disease and Addison's disease? You have the ACTH, which determines how well the adrenal glands respond to this presence of ACTH, which comes down from the pituitary. Most accurate when drawn toward the end of the sleep cycle when level is at its peak, typically between 4 0400 to 0800. Client should be fasting and screened for stress factors which can affect results. Results with this test, if they have Cushing's, will be increased or decreased, and with Addison's, it's always decreased. WHA at testing is done for both Cushing's disease and Addison's disease. That's the what this test is called here. Serum ACTH level, see how they respond to presence of the ACTH. We said it was most accurate when drawn at the end of sleep cycle, so that's between 4 a.m. and 8 a.m. in the morning. Cortisol levels can also be drawn. Remember, blood cortisol, Cushing's disease is increased, Addison's disease is decreased. Salivary cortisol preferred for mild Cushing syndrome. You can test this. Midnight preferred for salivary collection, cortisol level at its lowest. NPO for 15 minutes and no teeth brushing prior to this collection for this test. With Cushing's disease, salivary cortisol will be increased, Addison's disease will be decreased. Diagnosis can't be confirmed by salivary testing. Urinary cortisol, Cushing's disease is increased and Addison's disease is decreased. We're at slide 45 of 81 slides. We're going to be moving on to thyroid. So this completes our Cushing's and